your table, the experienced person probably should not facilitate, but they should help find somebody at their table who's willing to try facilitation. And the second role is a recording role. So one person is leading, which you're asking the questions, you're digging, you're curious. The whole stance for you here is how is it that you can practice safely and do the rest of your job? You know, how this is hard to do in the situations in which you work. How are you doing it? And mostly, as facilitators, you're very curious. That's your job. The recorder, who it's really good to pair with when you first do these, if you do them. The recorder is there to pay lots of attention to the little things, little actions that might be implied that could improve practice, or a practice that already exists, something that's tacit. You know how to ride that bicycle, but you can't tell anybody. You just know how to do it. So the recorder is there to find and listen for those tacit behaviors, things you know how to do that solve the problem, the transmission, and listen for those things that could turn into an invention of this group of people that solve the problem. So they aren't thinking about the questions, they're listening carefully to the conversation. So the first thing is, how do you know? First question you ask, you enter into a group, you say, you gather the people, maybe impromptu, or you may have invited them. You say, I'm here for a purpose. And so we practiced the purpose yesterday. Your purpose may be, we're here to eliminate all transmissions of BRE, C. diff, MRSA. The CDAD thing is still, I can't quite do it because it sounds like something else. So I'm here for a purpose, and you're kind of socially welcoming whoever is there. Could be standing up on a unit, could be in a little room somewhere, but you should go as close to where the work is being done as you possibly can. The question is very affirming, because everybody knows something about this. How do you know when MRSA, you probably need to pick one. We haven't talked about this, but if you pick one, maybe you're working on all of them. But I'm going to use MRSA. How do you know when MRSA is present? So a housekeeper can answer that question. A doctor can answer that question. Anybody you have gathered around. It affirms that everybody knows something, or somebody in your group is going to know something about when it is present. Gather that. Second question is, what do you do to protect yourself and others, presumably patients, from exposure or transmission to MRSA? So what do you do to protect yourself and others? Again, it's affirming. What do you know? What are you already doing? They exchange views. Third question is, what keeps you from doing that all the time? So this is the reality-based. You know, a lot of people are very, this is hard. You know, you need to talk about why it's hard. And lots of the barriers come up that we all know about. Then the next question, well, is there anybody around here who seems to effortlessly be able to overcome those barriers, to practice safely in maybe extreme situations where it's really hard to do it? But is there anyone you know, or any unit, or any place that seems to be able to practice effortlessly and safely? The next question is, well, how would we, if we would take one or two of those and kind of start developing that, what would some of the first things we would do? And then that same question is all about, oh, are there any volunteers? But do it in that order. If you say, are there any volunteers for some vague project that you haven't talked about, you probably won't get it. So what are the first things we could do to start to make this happen? Any volunteers? Final question, really important for spread. Who else have we been talking about? Who else should be here for us to take the next step? Who else should be here? When you hear the myth of this work, which is, this is just an inevitable part of modern healthcare, you can do this thing in which you flip it back to them. Okay, you're telling me that nowhere in this hospital, in any of the units, or any of the practitioners, or anyone here, you're telling me, you just reflect it back to them, that no one has practiced safely in the history of our institution. And then you might be looking at your shoes for a while. And other people at the table may come to your aid and have some positive stories to tell. So that's another thing. So that
That's a Jerry thing, the
that's
flip.
the flip, and it's a good thing because you're flipping a very realistic cynicism or doubtfulness about whether this would work.
I don't mind the marker by which everybody else.
Managed to get the room at your